Another feedback I receive about periodic benefits like the PG and the Merdeka generation packages is the inherent inequity for some of our senior citizens who, by virtue of their year of birth, stand to miss out on a few years of medical benefits because of the interval between one-time packages. Similarly, senior citizens who missed out on the more substantial PG package when they were between the ages of 60 and 64 in 2014 also feel that the eligibility age of 60 for the Merdeka package is inconsistent with the Pioneer package. To address such feedback, the government should introduce a basic level of medical benefits through a universal and permanent senior citizen healthcare package from the age of 60. Quite rightly, the Merdeka generation package announcement has led some Singaporeans to inquire whether our budget can support such a package for our senior citizens. There is good reason to opine that it can. Firstly, the introduction of Temasek into the NRC framework from 2016 brings an additional $5 billion a year into the mix instantly and about $25 billion across a 5-year term starting from this term of government. Notwithstanding the greater spending needs of the government that certain ministers have raised in the past, going forward, the 35% odd increase in the NIRC from 2016 goes some way to explain the healthy accumulated surpluses accrued to this term of government from the opening of Parliament in 2016. Secondly, with the Finance Minister Heng Swee Keat's announcement this year of new modalities of development, funding through borrowing, does this development free up revenue to fund recurrent spending? If it does, it would appear that funding such a universal and permanent healthcare initiative for our seniors cannot be dismissed as dishonest, unreasonable, or imprudent. Instead, it can and should be viewed as the key pillar of a strong and united Singapore. To begin with, the centerpiece of such a scheme should be aimed at alleviating the out-of-pocket expenses for primary healthcare, so as to address cost of living for all Singaporeans from the age of 60. Here, the additional subsidies for common illnesses and chronic conditions for outpatient care and meaningful discounts off subsidized bills at polyclinics and specialist outpatient clinics should be its central features. The additional components of both the Pioneer and Merdeka generation packages, such as top-ups to PA Silver cards, MediSave top-ups, and other specific enhancements such as the participation incentive to join CareShield Life or other unmet healthcare needs, can turn on the fiscal position of the government. This would also provide a sufficient buffer to allow each government to look into addressing more unique healthcare needs of specific cohorts or categories of workers. They would include those who had taken up gig economy jobs, for example, to address the CPF shortages of workers who made sacrifices when the government moved to cut the employer contribution of their CPF in 2003 to keep Singapore as a whole economically competitive. In addition, it is axiomatic that immigration is a permanent feature of Singapore for the foreseeable future. A permanent and universal senior citizen medical package would also represent a critical symbol of integration between all Singaporeans who hold the red passport, and it would follow that the eligibility age into such permanent schemes should be dispensed with. This is particularly so as about 20,000 new citizens are added to the pool of Singaporeans on a yearly basis. Mr. Speaker, when Minister speaks of developing our people on a lifelong basis, this House should not underestimate the peace of mind a permanent and universal medical package can give not just to senior citizens above the age of 60, but to all Singaporeans throughout their lives. Indeed, to be constantly reminded that a covenant exists between the state and citizen, vowing to assist all Singaporeans equally with their medical needs in their silver years, augurs well for a confident and assured society without compromising the work ethic. This is especially so as living in a developed country with one of the highest per capita GDP in the world comes with costs, particularly for the sandwiched middle class. As all Singaporeans commit their best years and pay taxes like the GST to the state throughout their working lives, a permanent package that helps our seniors manage their cost of living issues in their golden years will inject a powerful message of unity into Singaporeans of all ages.